Hello and welcome to Health Talk with Asif, an unprecedented podcast for doctors and health professionals designed to improve your English for giving presentations at conferences and communicating in the medical field. I am your host, Asif, and today we have a special guest, Dr. Ulkar Mursalova, who will be sharing her insights on pediatric epilepsy. Welcome, Ulkar.
Thank you so much for the warm introduction and for having me on your podcast. It's truly a pleasure to be here and share my insights on a topic that is so close to my heart, pediatric epilepsy. As a pediatric neurologist, I've had the opportunity to work with many families and children navigating this challenging condition. My goal today is to discuss the nuances of diagnosing epilepsy in children, the various management strategies available, and how we can support families throughout this journey. I believe that with the right knowledge and tools, we can make a significant difference in the lives of these young patients. I'm looking forward to our discussion and hope it will be informative for our listeners.
Thank you very much for joining us today, Ulkar. Before we dive into the topic of pediatric epilepsy, I'd love to get to know you a bit better and hear more about your journey. Let's start with a few personal questions to learn about your background and what inspired you to pursue a career in pediatric neurology.
I have always been interested in the complexity of the human brain. And when I was in university, I found myself particularly drawn to working with children. There is something incredibly rewarding about helping kids and their families navigate challenging health issues. The resilience and strength of children, even in difficult circumstances, inspired me to specialize in pediatric neurology.
What do you find most rewarding about your work in pediatric neurology?
The most rewarding part of my work is seeing the positive impact we can make on a child's life. Whether it's diagnosing a condition early, helping manage symptoms, or supporting families through difficult times, knowing that we are making a difference is incredibly fulfilling. There is nothing quite like seeing a child achieve milestones that seemed out of reach or hearing from a parent how much their child's quality of life has improved.
How to stay current with the latest advancements and research in pediatric neurology?
Staying current in pediatric neurology requires continuous learning. I regularly attend conferences, read the latest journals, and participate in professional networks and forums. Collaborating with colleagues and participating in clinical trials also helps me stay updated. I strive to attend courses abroad every summer for 2 months. For example, last summer I was at the Rambam Clinic in Israel, where I gained practical experience. This summer I spent 2 months at St. Mary Hospital in America. I have also had practical training in Dubai and Turkey. By doing so, I continuously broaden my knowledge.
What advice would you give to someone considering a career in pediatric neurology?
Choosing a career in pediatric neurology is incredibly rewarding, but it also comes with its unique challenges. My advice would be to stay curious and passionate about learning, as this field requires constant updating of knowledge and skills. It's a demanding but fulfilling career path, and the impact you can make on young lives it's truly remarkable.
What are the common signs and symptoms of epilepsy in children?
Common signs and symptoms include recurrent seizures, stirring spells, sudden jerks, and loss of consciousness. Other indicators can be unusual sensation, behaviors, or muscle stiffness.
How is epilepsy diagnosed in children?
Diagnosis involves a full medical history, neurological exam, and diagnostic tests such as electroencephalogram (EEG) to measure electrical activity in the brain, MRI scan to look for structural abnormalities, and genetic tests.
Okay, what types of seizures are most commonly seen in children with epilepsy?
Common types of seizures in children include absence seizures, tonic-clonic seizures, myoclonic seizures, and focal seizures.
What's an EEG and how does it help in diagnosing epilepsy?
An EEG records the electrical activity of the brain. It helps in diagnosing epilepsy by detecting abnormal brain waves that occur during seizures. It is very important to do VEG to make a more accurate diagnosis. Since abnormal discharges are usually visible during sleep and especially in the second phase of sleep.
What are the primary treatment options for managing pediatric epilepsy?
Primary treatment options include anti-epileptic medications, ketogenic diet, vagus nerve stimulation, and in some cases surgical interventions. First, we must start therapy with monotherapy, with an anti-epileptic drug. Raise the dose to a certain dose until the seizure stops. And if the seizure doesn't stop, prescribe a second drug. If this patient takes 3 or more drugs, but seizures continue, then we must start a ketogenic diet. And if this won't help either, we start vagus nerve stimulation. Or if it is focal epilepsy, we can do surgical interventions.
How do anti-epileptic medications work to control seizures?
Anti-epileptic medications work by stabilizing electrical activity in the brain, preventing abnormal brain waves that cause seizures.
What's the ketogenic diet and how does it help children with epilepsy?
The ketogenic diet is high-fat, low-carbohydrate diet that helps control seizures by altering the brain's energy source from glucose to ketones.
What's vagus nerve stimulation and how does it help children with epilepsy?
Vagus nerve stimulation involves implanting a device that sends electrical impulses to the vagus nerve, which can reduce the frequency and severity of seizures.
Here is my last question. Can children with epilepsy lead normal lives?
It mainly depends on the form of epilepsy. Many children with epilepsy can lead normal, active lives, although they may need to take precautions to avoid seizures triggers. Some children experience many side effects from seizures, such as developmental delay in both motor and mental development.
That wraps up today's episode of Health Talk with Asif. Thank you for listening and special thanks to Dr. Ulkar Mursalova for sharing her insights on pediatric epilepsy.
Thank you so much for having me on your podcast today. It's been a privilege to discuss the diagnosis and management of pediatric epilepsy, a topic that's incredibly important to me and many families. I hope that our conversation has shed some light on the complexities of this condition and offered valuable insights into the care and support available. We must remember that every child's journey with epilepsy is unique, and it's crucial to approach each case with a personalized and compassionate plan. Thank you once again for the opportunity to share this space and for bringing attention to such an important issue. I look forward to continuing discussions and advancements in this field.
If you enjoyed this episode, please subscribe, rate, and review our podcast. Be sure to follow us on Instagram, YouTube, Facebook, and TikTok for updates and new episodes. Just remember, the more we learn and care for our health, the more we enhance our well-being and professional practice. Until next time, stay healthy and keep learning.